Hello, welcome again. Dr. Anthony Gonzalez here with Miami Community Health. As always, we're bringing you important health topics. And today we're going to go a little bit behind the scenes with a health topic. You know that when you're in a hospital, you're in a doctor's office, you're getting care, you're getting a CAT scan, you're getting an ultrasound, you're getting any type of medical care, there are people behind the scenes that are preparing things for you. And I've brought the behind the scenes person, the man himself, Bill Duquette, to talk to us today about what happens behind the scenes. Doctors and nurses provide care, but we could not do that without the facility, the lights, the electricity, the operating room, the medications, the devices, the drugs, everything we need. And somebody like Bill Duquette, who is the CEO of South Miami Hospital, helps provide that. Him and his team are the administration that exists in a hospital or in an office setting or in a radiological center that helps you and I get medical care. So, Bill, welcome.
Welcome. Thanks, Tony.
All righty.
Pleasure.
So I want everybody to know a little bit about Bill and what Bill has been through and his career and what has led him to be CEO of South Miami Hospital. So tell us a little bit about your career.
Okay. Yeah. So I'm originally a med tech. I don't know if people know what med tech is, but I'm a laboratory person. You know, I went to the University of Miami, go Canes.
Yeah.
And studied that. So my first job, I worked at Jackson for a while, went back to school, the University of North Carolina, got a master's degree. And my first job within Baptist Health was at Homestead, which is James Archer Smith at the time. It's now Homestead Hospital, as the lab manager. And then little by little, I was asked to do things. And one day, Bo Bollinger, who's now the incoming president and CEO of the system, came to me and said, "Would you ever thought about coming to the dark side of administration?" So I guess the rest is history. Little by little, people moved around. I had the opportunity. I became CEO at Homestead. And then 3 years ago, kind of came over to South Miami Hospital.
So yeah, you had a great tenure at Homestead. Tell us about a little bit, some of the things that happened over there in Homestead and some of the great things you did over there.
Okay, sure. Now, Homestead's a different demographic, as you know. It's like a lower, I don't want to say all lower socioeconomic, but the per capita income, although it's changing, historically has been a lot lower than the Dade County average. So I think one thing, not to talk about Baptist Health necessarily, but for a system like Baptist Health or anybody to build a new hospital in a demographic like that, where you know you're going to lose money for a long time, really says a lot about the mission of Baptist Health. So anyway, that being said, Homestead was a great place. We had a great team. It's a 120 bed, 150 bed hospital, really serving critical needs in a community that is underserved.
Yeah, no, definitely. I know Baptist Health is about serving the community, and they'll do everything possible to, of course, make sure that they're secure so we can serve the community. So then you moved over to South Miami Hospital, and tell us a little bit about your tenure and what's happened over there at South Miami Hospital. Of course, there have been a couple years of craziness in those, everybody's last couple of years of craziness. But let's talk about your arrival at South Miami and how that was.
Okay, so yeah, I came to South Miami 3 years ago, July. So a little over 3 years now. And as you indicated, 2 of those 3 years or 2.5 of those was COVID. So it was kind of a blur. We pretty quickly, when I came on, we had a lot of ideas. I had a lot of ideas, and they were reprioritized quickly to meet the needs of what we needed to do take care of the patients with COVID.
Yeah. So talk about that. Let's talk a little bit about what happened in COVID. And, so, people can understand what happened behind the scenes. We as healthcare professionals were just trying to, either help, we had to stop surgeries that were elective because we didn't have personnel. But tell us about, as an administrator and somebody who's running a hospital and your hospital is being overwhelmed with COVID, what happened there?
Yeah, so it was kind of a difficult couple of years. My main concerns were things like, how do we make sure that not only our patients are safe coming in, but our employees are safe? There was a lot of concern about you guys in the surgery suites, the intensivists working in critical care, the nurses working in critical areas like the emergency room. At the beginning, because we didn't know very much about COVID, and there was a lot of concern about you kept seeing people dying and getting really, really sick. So I had a big concern about just how do I care and feed for the employees and the physicians and the medical staff? How do we make sure that when they go home at night, they feel comfortable interacting with their families? Because, we all have families, we have lives. So you would hear, I don't know what you did, but I would hear stories of people would go home, they would get in the garage or wherever, strip, take a bath before they put their clothes in the laundry, and then maybe go about their day. And like, how do you take care of yourself when you're out in the community? Now you see very few people wearing masks. I would still recommend masks, but anyway, because it's still around. But how do we train people to make sure that we're all safe? So I think a lot of concern was just care and feeding of the staff. And then for a time period, now it's not as bad, but at the beginning, probably a year, especially people working in critical care, there was a lot of people dying from COVID. And if you can imagine, not that it's PTSD, or it could be PTSD, but just constant every day, getting to know people, getting to know families, and then after a month, somebody dies. Or even your own employee. We've had a couple of employees, and we had a cardiologist on staff, you might remember,
yes,
get COVID really bad and ended up dying. So it takes a toll mentally and psychologically.
Yeah, no doubt. And so, of course, a lot of things have come of COVID, and we're still living with COVID, right? I mean, we still have COVID. Right. And is the hospital back to, business as usual, or have things changed after COVID?
No, we're back to pretty much business as usual. Our workload, our volumes are up pre-COVID. Although we still, when you go into a hospital, I don't know if you guys know, Miami-Dade County is still in red, has a high transmission, it's a high transmissible area. The prevalence of cases is still high enough that we need to take precautions. So the hospitals, you still have to wear a mask when you walk in, but pretty much other than that, it's business as usual. We've gone back to normal visiting hours. We've gone back to normal surgical schedules.
And so COVID put us through a lot of stuff. And I think one of the things we learned about also in COVID, that you don't always have to meet in person. Like one of the things that a lot of people have learned, Baptist Health is one of the institutions that have moved people away from the structure of the hospital, people working from home. A lot of meetings now done through Zoom and through Teams. What have you seen changed in the hospital setting now from COVID? What have we learned that maybe has improved our life from COVID?
That's one, definitely being meeting. It seemed like the intensity of meetings increased, and Zoom kind of exacerbated that. It fed into that, which I guess is okay. So frankly, it kind of helps. You don't have to travel a half hour, an hour to get to someplace to go to a meeting. And so that's helped. I think the other interesting thing is we've all talked about over the years in the healthcare arena, virtual consults. And we've really embraced that. For a long time when COVID was happening, a lot of doctors' offices weren't open, primary care physicians, family practice people, and they were seeing patients virtually. You get on your phone and you or even doing emergency room visits virtually, lower acuity kind of things. So I think that's something that we all talked about happening, and we were slowly getting there, but I think COVID kind of pushed that to be a kind of a standard practice. Right now, a lot of psychology consults are done virtually. People that don't really need to necessarily put your hands on, you probably know more than I do.
Yeah.
Put your hands on somebody, you can do virtually. And it makes it frankly quicker to take care of the patient and to get them where they need to be. And I think it's easier for the physicians that you don't have to go to 5 or 6 or 7 different places and make rounds. And so
it's more convenient for the patient.
For the patient,
if I've seen a patient once already, I've already put my hands on them. We need to do an imaging study, a CAT scan. We're going to follow up. I could just talk to them on the phone, do a virtual visit, and we could just talk about your study, as opposed to making them come, parking, driving, waiting in a waiting room. It's much more convenient.
I went to my primary a couple of times virtually. I'm like, I don't know if she's going to get the same information from me, but it worked.
Yeah, it always doesn't work when you have to examine, listen to heart, or check the prostate. That doesn't happen virtually. All right, so now of course we're post-COVID, or we're living with COVID. So what is happening at South Miami Hospital? Tell us some of the great things that are happening there at South Miami Hospital, and some of the initiatives that are going on over there.
Okay, well, South Miami is a great place. Hopefully you agree with that.
Of course.
It's a really good hospital. Just to give some accolades, U.S. News and World Report does an annual review of hospitals, and we're number 5 regional community hospital, and number 15 in the state, which is kind of a nice accolade. So what you guys do, our medical staff does, and what our staff does every day to take care of patients. We have a growing spine program, as we're all getting older or younger. Not all have, but a lot of us have back problems or back pain, or it's tough to get up and working and moving around. So we have a growing spine within the Miami Neuroscience Institute within Baptist Health, South Florida. We'll be housed at South Miami. We have a bunch of physiatrists. I don't know if you know what a physiatrist is. It's somebody who really takes care of like pain control and the spine and like movement, more different than an orthopod would, or even a neurosurgeon would. So we have an increased number of physiatrists, an increased number of neurosurgeons specializing in spine, doing specialized procedures. So, we can see the physiatrist, go to physical therapy, maybe do some pain control to keep people from having to go to surgery and postponing surgery as like an ultimate last thing for back pain. So spine is happening. And then we just continue trying to do a great job taking care of our community.
Yeah, no doubt. And one of the things that really grew out of South Miami Hospital and really was the impetus for our health system was robotics.
Robotics, yeah.
You guys are still, we are still, I'm part of that. I'm part of the reason, but I'm part of the reason why, but it started, robotic surgery really began at South Miami Hospital with our gynecologic oncologists, with our thoracic surgeons, and we in bariatric surgery followed along. And so now, of course, it's expanded everywhere.
So yeah, it's expanded everywhere, and it's almost like, I don't want to say an expectation. I'm going to have surgery. You're going to do it robotically. But South Miami still does the largest number of robotic procedures pretty much in Florida, I think, in Southeast United States. So yeah, we continue working on how do we enhance that, and how do we teach our sister hospitals the things that we can do with robotics, and how can we continue to grow that.
Wow, that's
service.
Great.
Yeah,
that's great. So, of course, Bill Duquette, obviously behind the scenes, our administrator, our CEO of South Miami Hospital, and he helps support the physicians and the healthcare providers, provides us, all the devices, all the things that we need so that we can provide care for our community. So for you as a CEO, what's the most enjoyable part of your day? I saw you yesterday in the OR, walking through the OR, and I was, what's Bill doing here in the OR? But what's the happiest thing that, what gives you the most joy as CEO?
The most gratifying thing is seeing great patient care and hearing from people like, oh, I was in your hospital the other day, or my wife was, or my whatever, fill in the blank. And, you guys did just a great job taking care of them. And they went home, they were happy. Your staff, your nurses, your doctors, everybody who interacted with them was very personable and caring. And so I think that's what's gratifying.
That's awesome. So one of the jobs of being CEO is that you're responsible for everything that occurs in your hospital. And you have outside entities, could be the government, who comes and inspects your facility. There's an inspection going on today at one of Bill's hospitals. And so recently we had an inspection of our bariatric surgical program. And so as a bariatric surgical program, we are nationally certified as a center of excellence, and we prepared for months, and they visited us for a day. And I wanted Bill to comment on what he thought, that experience was like. So they spent a day with us. They talked with Bill. They talked with the CEOs and the presidents of the health system. They interviewed our surgeons. They reviewed our charts. They toured our facility. They wanted to make sure that we were, providing state-of-the-art, high quality bariatric surgery. And so, of course, Bill was very instrumental and involved in that.
As were you, Tony. So thank you. Very instrumental in that. So first of all, this is a voluntary thing. As you know, you don't have to, if you're a hospital and you do robotic surgery, you have a robot or two or three or whatever, you don't have to subject yourself to this. So this is something we do voluntarily because we want to make sure that we're meeting and exceeding all of the standards, all of the expectations out there. And I don't know if do you know how many hospitals are MBSAIQ?
There's a few hundred. There's a few hundred around the country. Definitely.
So that really,
there's probably 3 in South Florida.
That to me is a long way of saying, we're really into quality. We want to make sure we're doing the right thing. So I think that's phenomenal. We're continue to seek that accreditation.
Yeah, what he's talking about is the Metabolic and Bariatric Surgery Quality Initiative, right, which is all about quality. Make sure you provide quality care. We have to make sure that we have the right tables, beds, gowns, blood pressure cuffs. We have the right personnel to take care of these patients who suffer from obesity. And it's a different group of patients and they have different needs. So obviously our bariatric surgical program has been around for over 20 years at Baptist Health, but has been at South Miami Hospital now for like 18 years. And within Baptist Health, we do all bariatric surgery at South Miami
So
Hospital.
let me ask, can I ask you about bariatric surgery? So
Me?
what is,
You're gonna ask.
yeah, what is bariatric surgery? What are you
So,
talking about?
well, bariatric surgery is weight loss surgery. So, we're talking about obesity, and obesity is really the biggest problem and medical problem in our country, because obesity leads to hypertension, leads to diabetes, leads to hypercholesterolemia. And South Miami Hospital and Baptist Health is taking care of people with heart attacks and strokes and people with breathing problems because they're obese. So if you can help deal with obesity, you can help cure the problem.
Okay, so when you say obesity, what do you mean? How do you define obesity?
Well, obesity is simple. It's simple. It's a body mass index. It's your weight in kilos over your height in meters squared. You can calculate that. We in bariatric surgery deal with the extremes of obesity. Somebody who is 100 pounds overweight, when diet and exercise doesn't work anymore, that's when you do bariatric surgery. It's weight loss surgery, and it's surgery to change your behavior so that afterwards you'll be losing weight in the first few months.
I'm sorry to interrupt. I had an employee, she thinks she still works at Homestead Hospital and was there. One day she approached me. So yeah, she's 100 pounds overweight. I don't know what her BMI was. She said, listen, I understand our medical insurance plan now covers bariatric surgery. How can I do this? So I asked her things like, because I knew we had within the system, we do this. So I asked her things like, well, have you tried dieting? Have you tried exercise? So what are the criteria? What are the qualifications for somebody? You just can't call you and say, hey, Dr. Gonzalez, I want to make an appointment to have bariatric surgery.
Yeah, no, definitely. You have to have a primary physician. You have to have failed medical treatment, which is diet and exercise. And diet and exercise goes a long way now because we have more medications for weight loss. So you have to have tried all that. We have in Baptist Health for our employees, we have coverage for them. And there has to be a well-organized program of attempted weight loss. The truth is that when you get to these 100 pounds overweight, the chance that you're going to lose weight and keep the weight off is around 1%. So that's why there is a need for surgery. But yes, you have to have failed diet and exercise. You have to have undergone a psychological evaluation, and you have to have nutritional counseling. And we have a very regimented program. That's what they just came and reviewed, that we educate our patients. Our patients have to go through a 4-hour class, and we give them a book to educate them and help them follow the paths, because we follow our patients for 5 years after surgery.
So what's the process? Okay, I tried pounds overweight.
A BMI of 40 is about 100 pounds overweight.
Okay.
So if your BMI is 40 or your BMI is 35 to 39 and you have diabetes or high blood pressure or sleep apnea, you qualify.
You qualify.
Right.
Okay.
So you have to be 75 to 100 pounds overweight.
Okay. So I meet that criteria. What do I do?
So if you meet that criteria, you look us up on, Baptist Health, and there's a weight loss surgery seminar that we give weekly. You can take it from the comfort of your home. This is something that changed with us with COVID.
With COVID, yeah.
With COVID. Before COVID, you used to have to come in and see and hear the surgeon live. Now we do it virtually from the comfort of your home. So we used to have 10 or 15 people attending these seminars. Now we have 50 to 100 people attending these seminars. So you hear a lecture from one of our surgeons. We have 4 bariatric surgeons in our program at South Miami Hospital. The surgeon will explain what obesity is, how obesity impacts your life, what the surgical options are. There's a question and answer session that occurs virtually. Everybody is anonymous. You don't know who's on the call. You just see initials. And after that, then our team will verify your insurance. And if you have insurance and you're interested in bariatric surgery, after you've heard the lecture and done this question and answer with the surgeon, you come and see us in the office.
So what does that entail? You don't just go to the office and have a visit and then you schedule it. Right?
No. Yeah. So you go to the office, you talk to the surgeon. The surgeon has to first determine whether you're a candidate and you're an appropriate candidate. I saw a sad story of a patient who saw me about 3 years ago. And she, of course, of COVID, didn't have surgery, came back. She's now on prednisone. She's now wheelchair bound. I wonder whether we should offer her surgery or not. So the surgeon has to determine the risk-benefit ratio. So the surgeon sees you, determines whether you're a candidate, are you an appropriate candidate, what is the risk versus the benefit, and then you begin the process of nutritional counseling, psychological evaluation, doing all that. it could take you 3 months, 6 months, 9 months. Then when you're done with all that, you come back and see the surgeon, and now we prepare you for surgery.
Okay. So even, let me ask you this, kids, even kids, teenagers, you see sometimes are obese and very heavy. So are they candidates? What's the age?
Yeah. So actually, interestingly enough, we got adolescent certification through this last site visit, and we've had it for years. Every site visit, we get the adolescent certification. That is 14 to 17 is called adolescence. And so we do operate as young as 14. First of all, they have to have mature bone growth. Number two, they have to be psychologically mature enough to make that decision. Though at the age of 15 or 16, they're not providing consent, they're providing assent. But I really talk to the youngster, because when the youngster is 16, in a couple of years, they're going to be 18. They have to live with that operation. So yeah, you can operate on adolescents, and we operate as young as 14, and we've operated as young as 80. But not every 60-year-old will have surgery. It depends on their medical conditions.
So if you don't have insurance, like what, can I ask you, like, what does it cost?
Yeah. So if you don't have insurance, Baptist Health has a self-pay package, and the self-pay of everything from the surgeon to the hospital and the follow-up, the education perioperatively and everything else can range anywhere from $18,000 to $20,000.
Okay. Oh, that's not too bad. Okay.
Yeah.
Good.
Yeah. We're never trying to be the cheapest. We're always trying to be the best. And so, of course, something of good quality may cost you a few more dollars.
So what's like the recidivism rate? You hear stories. I know somebody had weight loss surgery, they lost weight, and then all of a sudden they look like they're the same weight that they were before. And is there?
Yeah. So what you have to understand, and people ask me that, what's the chance of failure?
Failure,
right?
yeah.
And the problem is that we're not operating on your brain. And obesity is a behavioral problem. And so if you don't operate on the brain, then how do you change that behavior? So we operate on the stomach, trying to change the behavior. And that's why the preoperative education and the long-term follow-up is very, very important. So every operation has a chance of failure. The most severe operations and the most powerful operations, like a gastric bypass, has 5 to 10% failure rates. The sleeve gastrectomy,
that's not bad.
Sleeve gastrectomy, which is a operation very popularized nowadays, 10 to 20% failure rates. But it all has to do with preoperative education, the right mindset for the patient, and then obviously the postoperative follow-up. So if we follow you and we're seeing you in the office and you're starting to gain a little bit of weight, we could put you back on track. And, obviously the help of our support groups, we have our support groups at South Miami Hospital that are now done virtually as well. And the help of support groups and the ongoing follow-up can prevent that weight regain.
I tell you, I've seen some testimonials of your patients that are really heartening. That's made significant changes in people's lives. So thank you for doing that. So let me ask you really quickly. You mentioned cutting the stomach or whatever you said, that gastric sleeve. What are the different types of bariatric or weight loss surgery?
So obviously without imaging, and if you're interested, you could attend one of our information seminars, but the stomach is about the size of half a gallon of milk. And with the sleeve, we cut the stomach, making it thin and tubular like a banana. That is a sleeve gastrectomy.
Okay.
People think it's a sleeve because you're putting something inside. No, it's supposed to look like a sleeve of a shirt. Okay. So it's the sleeve. The gastric bypass, you take the stomach and you make it small, like a little egg, and you connect the intestines up to that gastric pouch. And that controls quantity and quality of food. The sleeve controls quantity, but not quality. So you can eat ice creams and cookies. The bypass controls quantity and quality. So you can't eat large amounts, but if you eat sweets, you get a dumping syndrome. A dumping syndrome is a jitters, a sweat, a diarrhea. It makes you feel ill. Remember, these operations are to control your behavior, change your behavior. So in the first 6 months to a year, you'll lose weight.
What's the possibility? I also heard this too. So let me just ask.
Yeah.
If you do whatever you call that, cutting the stomach, so it's a little thing, does it expand after people don't really go? Yeah.
So that's what people say. Will it grow? What happens is not that these stomach grows or the pouch grows, is that people are able to change their behavior and they are able to manage more with what they have. And the perfect analogy I give people is, you went from the house that was 5-bedroom mansion, and all of a sudden you go into a little efficiency studio apartment. At first you're tight, and that's what happens early on after bariatric surgery. But with time, you get organized in your little studio apartment and it's roomy. And you get accustomed to what you have. And so it's not necessarily, because I've seen people who regain weight and all the anatomy is perfect. It's just that they've been able to outsmart the operation, right? Remember, it's your behavior, and we're humans, and we adapt to what we have, and we adapt to what the disability that has been imposed on us. You may have a shortened leg, or you may be missing a leg, but you could still run a marathon. And so just because you've been implemented or inflicted a disability, made your stomach smaller and not able to eat, you can overcome that. And that's what happens. We adapt to our environment, and we adapt to what's been happened to us, and we gain weight.
Do people just, another thing I was just curious about is, how many people have, I don't want to say bad outcomes, but immediate post-surgical, what are the things you got to look for, complications?
Yeah, so every operation has a risk of complications, right? The only way to avoid a complication is not to have surgery. And, with bariatric surgery, we're cutting. So we're operating on you, we're cutting. And so there's a risk of bleeding. We're also giving you blood thinners because we don't want a blood clot to go to your lung. So obviously the risk of bleeding exists. The risk of bleeding is 2%. The risk of requiring a blood transfusion is 0.5%. So it's very low. And, most bleeding stops. And if it doesn't, you would need reoperative or another surgery to stop it, but that can be stopped. And then when we cut the stomach, staple it, suture it, do these connections, we want to make sure that everything is perfectly airtight, that there's no infection. 99.9% of patients will never have a problem. 0.1% can get an infection, a leakage, what people are worried about. So today, with the advancement of laparoscopic surgery, advancement of robotic surgery, what we do at South Miami Hospital, these complications are minimal because of all these advances in technology. So it's very safe. So bariatric surgery is as safe as a gallbladder surgery, as safe as a hysterectomy, as safe as a hernia operation. So these operations, though they've come a long way and they're technically more extensive than a hernia operation, they're really as safe as those operations.
Okay, so somebody's 100, 150, 200 pounds overweight. They go through the process. They have weight loss surgery, whichever kind you guys decide to do, and then they get down to a normal, whatever's normal, BMI and weight. So what happens to all the skin?
Yeah, so no doubt. So what happens is people will lose weight in the first 6 months to a year. Usually after a year, not much weight loss is going to occur. And obviously after a year, we explain to them that at that point, if they want to have plastic surgery, they can have. So of course, if they have sagging skin, sagging body parts, they can have reconstructive surgery after 12 to 18 months. Another question that always comes up, because about 75% of our patients are women, they're always worried about pregnancy. So we also say no pregnancy for 18 months. So plastic surgery, they can have it. There are patients who don't have plastic surgery because they don't want it. They may need it, but they don't want it. So if they don't want it, that's fine. You don't have to have plastic surgery. You don't have to have reconstruction, but 18 months for plastic surgery and 18 months for pregnancy.
Okay. So let me ask you this. I see ads. I'm sure you see ads on TV. Go to weight loss surgery at Brand X Hospital, or go here, or blah, blah, blah. Why should somebody come to Baptist Health?
Well, obviously,
I don't know why, but
because of you, because of people like Bill Duquette, because Baptist obviously is quality. When you think of Baptist, you think of quality. We don't cut any corners. We provide the best care. We're nationally certified, voluntarily certify ourselves. And so what you're going to get is quality there, as always. And so if you're looking for expertise, I don't brag about myself, our team, we're nationally known. We are the people that are teaching others how to do this. We are the ones that are publishing in the medical literature about robotic surgery and bariatric surgery. So we have the experts, we have the excellent facility, we have the facility that provides us all the technology. We don't care at Baptist Health how much a robot costs. We provide it because it's best for our patients. So yes, because we're a center of excellence, because of the fact that we provide all this excellent physician care, nursing care, and technology, that's why it's always better at Baptist Health.
You know, we also have a specific inpatient area dedicated to the bariatric patients, the nurses, and the staff.
You get dedicated rooms. You get dedicated nurses that know how to take care of those patients. You're not going to just be thrown anywhere. You're not going to be sent home after surgery. What happens if there's a problem at home? Who's going to help you at home? We keep you overnight as a precaution, just to make sure that everything's okay. So yeah, we're not cutting any corners. It's all about quality.
And we've had cases. I get called every once in a while. Hey, listen, this person's in the ER. They had the weight loss surgery at the name that not Baptist Health, and now there's a bad outcome and complication or something. Anyway,
Yeah,
So
as a no, but as a center of excellence, we're committed to
we're
taking
committed.
care
Yeah, you do. You do a
everybody.
great job. You do
And
a
so
great
if you end up at Homestead or the Keys and you had bariatric surgery, we ship you right up to South Miami Hospital. We have our bariatric surgeons on call 24 hours a day, 7 days a week. It doesn't make a difference whether you had surgery in the United States, outside the United States. I've had patients who've taken a plane and come to South Miami Hospital to be cared for, and we help them, we adopt them, we fix their problems. It's not a problem.
Yeah,
We're
so-
committed to patient care. We're committed to bariatric surgery.
Thank you. You
And
guys are awesome. Last quick question.
Yeah.
What's your favorite hot dog restaurant?
Our betters. Hey, so I want to thank Bill for being here, and thank you for the support that you provide.
Thank you.
Thank you to Baptist Health and South Miami Hospital. We could not have done what we do every day for patient care without people like Bill and his team and all the administrators. So, when you're in an ER, when you're at a doctor's office, when you're laying in a hospital bed and you look around, you get the air conditioning, you see the care, you see the bed, you're having medications, you have an IV. You have to think that these people like Bill and his team that are providing all that. I'm not the person who turns the lights on. I'm not the one that provides security. I'm not the one that provides, all the medications. We provide the care, but we couldn't do it without these administrators. So, Bill, thank you again.
No, thank you.
Thank you.
Everything.
And once again, Dr. Anthony Gonzalez with Miami Community Health, educating our community about their health. And thank you once again for being